series of podcasts on the models in which we've been using in AP2 lab. This one we are looking at now, we'll be discussing the structures that you can see on the eye. The eye model you see here is the one we've been using in class, the one you will be using in class, which is a very good eye model. Most of the structures are visible. I'll rotate it down so we can look at it in the view we are most familiar with seeing it. This is sitting in anatomical position. A few things we do talk about in AP2 on the outside are all visible, and a few structures we will go ahead and mention while we're looking at it in this position is the major parts that you will note that are at least of interest to us here. We have talked in the past in AP1 about our superior rectus muscles and our superior obliques, our lateral medial rectal muscles, rectus muscles. We really don't go into too much detail about that, just a refresher from AP1. But the first structure we're noticing here is the whites of the eye, which you will see in all surfaces of the eye is referred to as the sclera, and that we will see is a very tough portion of the eye. And one of the things we'll continue to talk about as we say how fibrous and tough it is kind of a natural conclusion to go straight on to this outer clear covering referred to as the cornea, which the cornea and the sclera together form what is called the fibrous tunic. So the fibrous tunic can be comprised of our clear, very tough and flexible cornea and the very tough and flexible white, opaque sclera. The rest of the structures we want to discuss on the outside can be seen back here, where cranial nerve number 2, the optic nerve, passes through, and the blood vessels that supply the vasculature and cells and tissues of the eye. So from the back behind here, we can see the yellow portion of the optic nerve passing through. And that does it for the structures that we would generally talk about on the outside. And we'll talk about all the structures that you can see, but I'll go ahead and start removing these parts of the eye. And it does kind of behoove us to discuss these in layers. And the first one we'll see on the outside here is referred to as the choroid. Very brown covering on here on the inside. We move into the next tunic and we'll be discussing these layers internally. So we can see the vasculature on here, blood vessels, both arterioles and venules, and then we can see our nervous tissue on here as well. So this all in situ can be seen on this as the choroid, which is one of the portions of the eye we discussed. As we continue on with our eye model, we do simply have to remove this outer part. When you do your eye dissections, you will be looking at a very similar kind of cross section as this, cutting it through the cornea all the way across and looking in a cross section very similar to this. One thing that stands out very clearly is this very large clear plastic piece. This is a representation of what's known as the vitreous body. The vitreous body is formed by a substance called vitreous humor, which takes up the predominant part of the eye here. Inside the eye, it takes up the bulk of what's referred to as the posterior cavity. The posterior cavity of the internal part of the eye, we can see here quite distinctly. So what I'm going to do is lay it down here so we can talk about it a little bit more in detail. The posterior cavity in which we're observing here has a few different portions to it. In general, this outer layer is the choroid, inside here is the retina. So choroid on the outside, retina on the side, choroid, retina. The retina internally here is comprised of an area referred to as the vascular tunic, or the neural tunic. Here we refer to it as the neural tunic. We do have parts of the neural tunic and the vascular tunic. The neural tunic is where the bulk of our photoreceptors lie. The photoreceptors, the rods and the cones, of which primarily in this area there are no photoreceptors. So one of the first parts of the vascular tunic we talk about is this area in the back known as the optic disc. So the optic disc is the first little area in the middle where the cranial nerve number 2 passes the optic nerve, and the vasculature will come through and move across on top of the neural tunic. This area where it is vascularized and where the optic disc is often referred to as the blind spot. We will move up into the vascular tunic that we will see here. The vascular tunic, it usually gets darker when more stuff gets placed in here, but you can see the vascular tunic. We move the light a little bit and get it a little more well lit. And we can see a structure here with a serrated edge called the ora serrata. And that structure that we refer to as part of the vascular tunic, the ora serrata. We continue on and we see the rather large, very rigid lens that is solid and very hard. You will know that in your sheep eye when you dissect it. When we put it back in, we will note that the lens back is referred to as the posterior cavity. When we take the lens and the retina and choroid and place it all back into the sclera together, we will form a structure known as the anterior cavity, or the anterior chamber. And the anterior chamber or cavity is from the lens out. And so those things we can see is a really nice time to discuss that. And I'll go ahead and take this back out and take the lens out. So we can discuss a structure here known as the iris, which is a series of the colored parts of the eyes, which also have some musculature, which will allow the diameter of this to open and close, which will control the size of this aperture known as the pupil. The pupil is more of a lack of structure than it is the presence of a structure. As you go on to discuss in AP2 lab about the transmission of light through the eye, you will note that the light, as it passes through the pupil and comes through the lens here, the light gets focused on this dot that is indicated by a pink area known as the fovea centralis. It is not on your structure sheet, but it is very important to note that the light will pass through and land here, which is the predominant site for most of the color vision in your eye. Your sharpest vision acuity is found here, to where the bulk of the cones, the photoreceptors that are responsible for viewing color, is present. And as it goes from the eye, that is generally all the structures that we will discuss in terms of what will be on the practical. Again, as a reminder to look over your structure sheets and what you can find there. But everything else will be on there, and you also want to ask your lab instructors about any other structures that are not visible on these models that may be on your structure sheets as well, especially when it comes to rods and cones and how we understand how light passes through. For the rest of that material, you need to consult them, your textbook, and your structure sheets. And this concludes our podcast on the eye model. We'll continue on once we continue looking at other structures such as the endocrine system, which we will be covering in a later podcast.